Good morning, everyone. The first Louisville Metro Board of Health meeting of 2023 is called to order. This meeting is being streamed live on Facebook. To Louisvillians, may 2023 be healthful, inspiring, and positive system changing, yielding improved health status for all. May the work we do together transform our community into a model city for the nation, along with Mayor Greenberg's great guidance. May our work take us to the top of America's national health rankings from today's ranking at the near lowest spot. It will take both public and private sector leadership, including everyone on this call, to accomplish that. I know we can do it. We welcome to the meeting Mayor Greenberg, who is a member of our board, and I'm going to interrupt here and allow him to say a few words and then invite him back for a the full Monty in terms of priorities in February, if that works out for you, Mr. Mayor. And Nicole is here, Deputy Mayor Nicole George, who has tremendous lived experiences in the South End and in being a community leader there, as well as her own profession. And we'll hear more from her on priorities. But as you know, the area she represents is one of the highest in terms of lack of access and equity. And so it is wonderful to have her in a leadership position to address that and much more. So I'm going to stop right here, Mr. Mayor. The floor is yours. Understanding that we want you back when we can have our little Q&A session.
Great. Well, thank you, Heidi, and thank you to everyone for your commitment to public service and public health in particular. I'm really supportive of the work that you all have done. And as I think I mentioned on the last time I was with you guys during the campaign, really respect all of the amazing work that you all did during the challenges of the pandemic and leading Louisville along with Mayor Fisher and his administration through the challenges that we had in the pandemic. So thank you all very much. You all have my highest respect. Just very briefly, I'm excited to work with Heidi, you, Dr. Howard, the rest of the public health team, knowing how important this is to the future of our city. In my inauguration speech on Monday, I talked about this as one of the three key areas that I'm focused on along with Deputy Mayor George and other members of our team, is making Louisville safer, stronger, and healthier. And that's far more than just reducing physical illness these days, but it's about mental health, it's about emotional health, it's about physical well-being, it's about the quality of our air and urban sustainability initiatives, it's about addressing our homeless crisis in a very holistic way. And so all of these are some of our community's biggest challenges, but they're also some of our biggest opportunities. And so that's why I'm excited to work with you all. And I know that Deputy Mayor George is as well, as we get right into it. So that's really all. I just wanted to say thank you all. And I look forward to working with you. I look forward to meeting with you guys, a few of you all from the team in person as I do a deep dive with every department here over my first month in office. So if that's not already scheduled, hopefully that will get scheduled this week for sometime this month. And I certainly will be back at many meetings. So just with all the craziness of the first week, I didn't have it blocked to be with you for this entire meeting, but I certainly will do that in February or at the next meeting. So with that, thank you. I'm going to stay on for a little bit. I look forward to Dr. McCants' presentation, but then I'll have to sign off in a little bit. But thank you all so much.
Well, thank you, and thank you for your commitment all during it. I think you've over-earned your position on the board because of the many times you've spoken and shared your views. And we know you place public health at the top of the list along with public safety, and because that is a part of the determinants of health. And I know that together, as I mentioned, we will go to the top of the list in state rankings. And I'm a huge competitor, as most people know. So we will get there together. Let me do two pieces of business. Mr. Mayor, especially since you're here, you get the vote. First order of business is the approval of the December board minutes that were contained in your pre-read materials. Any questions or edits for the minutes? Otherwise, the chair will entertain a motion to approve the December meeting minutes.
As an edit, I would just like to add my name on the present members voting for the last.
Thank you. Sorry about that. And Arlena, if you will make that change, please. Is there a motion to approve the edited minutes? Second?
Second.
Any opposed? Motion carries, and the December board meetings are approved as amended. This morning's perspective session features Dr. Kelly McCants, who will share his perspectives on the impact of housing redlining on public health and related health conditions. Dr. McCants is the medical director of the Norton Health and Vascular Institute's Advanced Heart Failure and Recovery Program. He also leads Norton's newly launched Institute for Health Equity at the Village at West Jefferson in the Russell area. Per a Courier Journal article, I love this, Dr. McCants' medical curiosity and subsequent career was sparked in the 10th grade by his biology teacher and his dissecting a starfish. She identified a National Institutes of Health program that helped minority students launch a career in biology or medicine. Dr. McCants attended Meharry Medical College in their cardiology specialty program, followed by the University of Louisville with fellowships for his internship residency, which was done at U of L Hospital. He then went on to a position in Atlanta before returning to Louisville and to Norton. His lived experience allows him to know personally the challenges that Black providers and the communities they serve. He has two daughters. Dr. McCants, I need to locate you on my screen. There you are. And welcome.
Good morning to everybody here, and thank you, Heidi and Dr. Howard. And I see a lot of familiar faces, so very excited to share a few thoughts this morning. And good morning, Mr. Mayor, as well.
Morning.
Can we put Dr. McCants' slides on the screen, please?
And Heidi, you'll have to keep me honest time-wise, because
don't worry, I'm really good at that. The board will share that, because you've got doctors on here who have patients, and I'm paranoid about no patient waiting. So there we go.
And I see Valerie on here also. It's been a while.
Yes, Dr. Val, we call her.
That's right.
And if you will just say next slide, then we'll advance them for you.
All right, next slide. Let's get right into it. And so I like to start this conversation with this slide. And this is a slide taken from Dr. King's address in the 1960s. And I'll be careful to read this, because I think it sets the stage for any discussion about disparities and social determinants of health. It says that, and mind you, the language is from 1966, but it says that the Negro is criminal. You see, he has the highest crime rate in any city, and these arguments go on and on. But those who put these arguments forth never go on to mention the lagging standards in the Negro community. They never go on to say that these criminal responses are environmental and not racial. Poverty, ignorance, economic deprivation, and social isolation are at the heart of what we're discussing. Next slide. And so, to set the stage, I don't think that anyone on this call would be remiss to understand that redlining and zoning reforms were very instrumental in creating healthcare disparities and socioeconomic deprivation. And here's just a quick map of Louisville. You've heard this and seen this time over and over and over again, but these policies change the life expectancy for the folks that live in these affected areas. And the difference is almost about 12 years. You can go on to the next slide, please. And so when we start speaking about redlining, I always like to set the stage and say, this is not a policy that was developed in Louisville. This policy was developed in Baltimore, and it was rampant across the entire United States, but more rampant in the southeastern United States, where there's a large population of African Americans. You can go to the next slide. And so when we start thinking about the importance of redlining, I'll make it simple. Health is tied to housing, housing is tied to wealth. And so you cannot have a discussion about health without understanding the importance that housing and historical policies created as we think about how to change where we are now. You can go on to the next slide. Where we are. And so these zoning decisions really allowed some neighborhoods to look completely different than others. And that's why you see some of the unsightly things that you see when you drive westward, including liquor stores, nightclubs, and housing, the way that it is in terms of its dilapidation. We understand that these were zoning reforms that created what we're dealing with, and we never understood the impact it would have on healthcare hundreds of years later. You can go to the next slide, please. And so a little bit of history. I learned this history, and some of you may know this. And so this is a picture of Harlan Bartholomew. He was the city architect commissioned by FDR to basically enforce and develop designs to keep desirables located in a certain part of the city. And so you can go on to the next slide. When you see cities across the United States where African Americans are concentrated in the inner city area, in the downtown area, it was by design. He was very effective in what he did. If you research him, look at St. Louis, and you will see that St. Louis looks a lot like Louisville. Look at Louisville, you'll see it looks like a lot like New Orleans, Memphis, et cetera, et cetera. But he was very instrumental as a city architect with designing a city so that basically some people did not have access to resources. And so this was by design, and you can see it across the southeastern United States. You can go on to the next slide. And so there's no better image than the one that we have here. And so on the left is the city of Louisville, and this is a redlining map from the 1900s. You see the crest of the Ohio River looking at downtown. While you look to the right, these are mirror images of each other, and this is the city of New Orleans. And you see the Mississippi also forms the similar crest. I can go on and show you examples from Memphis to St. Louis, but it all looks the same to where the areas that were heavily redlined and designed by that certain architect that we mentioned, where certain populations were almost confined to certain areas, and these areas were certainly deprived with time. You can go on to the next slide. And so at the same time, certain populations were being restricted, other populations were being supported, creating this kind of polarization as it relates to housing. And so if you look at what we have here in the mid 1930s, when redlining was at its highest, FDR's administration, along with the Homeowners Loan Corporation, supplied almost 1 million mortgages with support. So 40% of the United States population, mostly non-African Americans, were giving mortgage support while certain populations were being deprived. Again, creating in the 1930s this distribution of housing or wealth associated with housing that we still haven't been able to normalize almost 100 years later. You can go on to the next slide. And it's important that we kind of set the stage like this because we understand that it's going to take time and intentionality to go beyond these changes. But this is just a slide showing that even if you were in the war and you returned, you know, the government guaranteed housing support for many veterans, but those mortgages were administered at the local level. And so the bank still had the opportunity to deny mortgages, even though these folks have served their country. You can go on to the next slide. And so when we start thinking about policies that affect social determinants and public health, it took 100 years for us to get to this point, and it will take a considerable amount of time and intentionality to change that. And so I always like to set the stage to say there's no question what exists, but the real message is how do we be intentional about working together to change it? You can go on to the next slide. And so a perfect example of this, and you can go on to the next slide, is to look at the tree canopy, particularly in the city of Louisville. And this, what we're seeing here, comes directly from the city's health equity report. And if you look at what we have here, this is that geographic location where 86% of all African Americans live in the city of Louisville. And what I have highlighted is if you look at the center here, this is vegetation coverage. And so there's an inverse relationship between tree canopy and air pollution and air toxin risk. And so this is just an example that says and supports the fact that where you live actually matters in terms of air toxins and air pollutions, and of course, kind of sets the stage for an environmental discussion as well. You can go on to the next slide. And so not to beat this to death here, but when we look at the commercial industry in the West End compared to the commercial industry in the East End, almost 50% of Louisville's industry is located in the West End compared to the East End, less than 3% green space in the entire West End of Louisville compared to almost 20% green space once you go eastward. Next slide. And so where you live is extremely important. Again, you drive about 4 miles westward and you lose about 12 years of life just from moving your vehicle west on 9th Street. Next slide. And so again, this heat map is taken from the city's health equity report. When we start to look at the neighborhoods that make up West Louisville, it is clear that the challenges exist not only in education, income, crime, and transportation, but I think the most concerning point is that there's no home ownership. So 70% of the folks in West Louisville are renters. More importantly, 60% of the head of the household are female. Again, in contrast to East, 80% of folks that live in the East End of Louisville, the head of the household is a male. And so there's a completely different contrast in terms of who's the head of the household. The median income is about 22,000 in this area. There's one banker for every 1,200, in contrast to moving eastward where there's one banker for every 200. We all understand about the food securities, very limited in terms of grocery stores, sit-down restaurants, and we've heard this time and time and time again. I think one of the things that we learned through the pandemic is that the utility disconnection rate in this area is up to 40% over a 1-year period. And for someone like myself, who's a cardiologist who sends people out on mechanical circulatory support, they have to have power. And so sometimes we're limited in terms of what we can do if people live in certain areas where they may lose their utilities. You can go on to the next slide, please. Next slide, please.
Up here. There we go.
And so enough of beating on Louisville. When you look at this, this is not just Louisville. If you look where most African Americans are concentrated, 65% of the entire African American population lives in these 16 states, which are heavily in the Southeast. You can go on to the next slide. You'll see that the same disparities are represented in those cities as well. For example, what you're looking at is a map of Savannah, very close to Hilton Head, where we like to visit. But if you look, 86% of all African Americans in Savannah live in these two zip codes. Sounds familiar? Go to the next slide for me, please. In those two zip codes, which is highlighted by Savannah's Health Equity Report, there are challenges in income, challenges in food securities, lack of grocery stores, and again, a higher concentration of the African American community. You can go on to the next slide. But here's what the concern is. Before we were speaking mainly about social determinants, redlining, etc. But when you look at chronic disease, it follows that roadmap. And so these are those same two zip codes where you see challenges in heart disease, diabetes, and guess what? These same two zip codes had the highest rate of COVID infections in anything that you can measure. And so now I realize I'm showing you Savannah, which is over 600 miles away, but I could have easily picked Knoxville. I could have easily picked Memphis, could have easily picked Chattanooga, could have easily picked New Orleans. It all looks the same. You can go on to the next slide. And then here's that life expectancy difference represented in Chatham County, which is in those two zip codes that we talked about in Savannah. You can go on to the next slide. And so here's the real challenge. And so this data here comes from HRSA. So now we're not looking at the local data from Savannah or Louisville. We're looking at things from a national standpoint. And this slide represents the relationship between cardiovascular disease and unemployment level. And if you look, when you look at the demographics, look what population suffers from both cardiovascular disease and unemployment level. So there has to be a relationship there. If you fast forward to the next slide, please, you'll see that you can almost superimpose these graphs when you start to look at homicide. So now there's a direct relationship between cardiovascular disease, homicide, and unemployment level. And these are national statistics. And look at the population that is at risk for all of these. Okay, you can go on to the next slide, please. And so when we start thinking about social context, I like this particular study, and I think this came out of Harvard. And so the link is at the bottom, and Heidi, you have the slides, and so people can pull
Yes.
this particular study. But
And we sent it to the board, so
good,
I believe.
good.
Yeah.
So the most important point here is when you start thinking about social isolation, which I spoke about in Dr. King's message at the beginning. You're looking at degrees of social trust, the extent of social networks, which is crucial, and then mutual aid and reciprocity, which all happens in a community. But at the entrance of this particular diagram, you see racial residential segregation, and on the exit, you see health outcomes with all of those social constructs in the middle. And so it's impossible to talk about health outcomes without dealing with the things that are highlighted in the middle. You can go on to the next slide. And so in the interest of time, I'll move quickly through this, but the links are at the bottom in terms of the reference here. But I thought this was pretty important. When you look at punishing toxic neighborhood environments, and you look at the social mobility that's intergenerational, you see that there is clearly a bimodal distribution based on race. Let's go on to the next slide. And I'll make it simple for you. Go all the way over to the right, and this particular model, which looks at a variety of different predictors, including poverty rate, lead exposure, community organizations, violent crime, and incarceration rate. And guess what? There's a certain population that has all of these predictors, and this model is very representative of that. You can go to the next slide. And so when we start thinking about neighborhoods, and I like this representation of a harshness toxicity factor. And you can see you're looking at income rate, incarceration rate, teen birth, anything that you can measure that deals with upward mobility or the success of a people, you can see that a certain population is disproportionately affected. You can go on to the next slide. And so what do we do about it? And you can go to the next slide. As large healthcare organizations, which touch 1 in 2 people in the city of Louisville, we have a huge responsibility, and we want to be leaders in how we address health equity. And access is always number one, not just access to primary care, but access to specialty care. And one of the things that continues to be relevant in the surveys that we do, in what we see from the patients that we treat, is transportation. I never would have thought transportation would be so high on a community needs assessment or a survey, but it almost ranks number one, which tells us getting people to the care is still a crucial problem. And so having a hospital located in a neighborhood where people can have access to in close proximity becomes crucial. You can go on to the next slide, and I'll move a little quicker here. And so here's the data. When we start to look at utilization of hospital services, it's clear that those that occupy the West End have almost twofold inpatient admissions, twofold emergency room visits, and of course, outpatient surgeries are also 1.5 times higher. And so when you look at the data in terms of why you should put a hospital in an area that has been historically ignored from a healthcare standpoint, the data is there. This is the population to where our resources are going to, and we might as well make the access reachable. You can go on to the next slide. And so talk about the disease states: cancer, heart disease, stroke, and anything that you can measure continues to be an issue. You can go to the next slide, please. Mental health, substance abuse, everything that we talk about. You can go on to the next slide. But I think one of the most important points that I glossed over that was really important was trust. For the first time, trust bore out as an important predictor in our community needs assessment. And so this is a little bit of a deeper dive into the neighborhoods of Portland, Russell, in California. I know initially we talked about social isolation, economic deprivation, but somehow when you start to look at these colors, you see if blue represents non-African Americans, red dots represent African Americans, still, even within poverty, certain groups tend to cluster together, which goes back to that social context that I was talking about. But nonetheless, the most important thing here when you look at patient profile, if you look at the pink there, 60% of the folks that we're talking about are women. And so if we're not careful about how we deal with women's services, women's health, and understand what the head of the household looks like, we're really missing some opportunities there. Next slide. Just need 5 more minutes, Heidi. And so
You got
this
it.
is the Institute. This is the Institute for Health Equity that she spoke about. It's located on 12th and Jefferson. And this institute is a brainchild of our CEO, Russ Cox. I just happen to be a steward of the mission, vision, and value that he set in place. And our job here is to be the community-facing arm of Norton Healthcare. And you see, I don't do it all by myself. We have community medical directors. I started with a team of 3 about 2 years ago. We now have a team close to 30. And so really excited about the work that we do out of the Institute. And our job is simply to build bridges to have those uncomfortable conversations with community-based organizations with healthcare at the center. You can go on to the next slide. And so in this village, we have Park Community Credit Union, we have a Head Start program, we have a business incubator with Dave Christopher, we had housing with Louisville Housing Authority there. The point is, this village really circles that social determinant of health. And so if someone needs resources, everything that is needed, at least for the folks in the Russell community, as we look toward the other communities, it's all in Molo Village or the village at West Jefferson. You can go on to the next slide, please. Now, let us not forget that this is not Norton's first intentional investment in the West End. Of course, we have the YMCA at 18th and Broadway, the Sports and Learning Complex. We have the relationships that are so important with Bates CDC, as well as with Simmons College and St. Stephen's, where we're launching medical programming out of both of those institutions. You can go on to the next slide. My definition of equity is that health equity is not about treating patients the same. It's about identifying and overcoming differences. I started this conversation with Dr. King's slide, which in his era, we were thinking about sameness. Well, we missed the opportunity for sameness, and now the focus is on equity. Next slide. And so some folks don't understand the difference between equity, inclusion, and belonging in an Institute for Health Equity. I always just like to say every organization since the social injustice that we all experienced has a diversity, equity, and an inclusion arm. But the Institute for Health Equity is really that external focus opposed to the internal focus represented by a diversity arm. And our job is simply to build relationships with the community and represent the organization the way that it should be as we are collaborative with the folks that we take care of. 2 more slides, I think, and I'm done. You can go on to the next one, please. Next slide. Next slide. And so, of course, we're building, back up one, please. Of course, we're building the first hospital in 150 years in West Louisville. We're very excited about this location on 28th and Broadway. This is over $100 million investment, about 80 million from Norton Healthcare, another 30 million from Goodwill. And for our purposes, this is a full service hospital. So we'll have 20 inpatient beds, an emergency department, adult and pediatric primary care. What I'm most excited about is specialty care. And so while primary care is important, having women's health, cardiology, neurology, endocrinology, and all those specialty services become crucial. We're hoping to see our first patient here in the fall of 2024. You'll start to see steel flying in March, and we're very excited about our efforts in the West End in terms of launching the first hospital in 150 years. Almost done. Go to the next slide. And so how do we get here? We were not naive enough to build a hospital without talking to the community. And so we administered almost 6,000 surveys. Some of them were administered in hand-to-hand fashion. You see the stack of paperwork here, but let me walk through that survey for you, and I promise I'll be done, Heidi. Go to the next slide. And so we polled about 50% of the folks that had a strong relationship to the West End. You can go on to the next slide. And when you look at the demographics, of course, 64% were African American, 17% were non-African American. You can go on to the next slide. And what we were asking is, what are your challenges to seeking healthcare? And when you look at the overwhelming results, it still came to access. No evening or weekend times available. Once you get to a provider's office, either it's too long in the waiting room or it's too hard to get an appointment and they can't find a provider accepting my insurance. These are all access issues. And so we wanted to go into the West Louisville Hospital understanding what we were dealing with so that we don't build the same hospital that we built before, but we're building something newer, more efficient, and actually something that we're taking feedback from the folks that we're going to serve very seriously. You can go on to the next slide. And so when you start thinking about what services people were looking for, women's health was number one, followed by mental health. And of course, somehow cardiology fell in as a number 4 or 5. I'm not too excited about that. But clearly, specialty care was important. You can go on to the next slide. Safety features, natural lighting, green space. You can go on to the next slide. And this was pretty interesting. What was most important in choosing a doctor or provider? Not how smart the physician was, not how reputable the physician was nationally. It was, do they accept my medical, healthcare, and insurance? And can I trust them? Can I trust them? And so we heard this, and this is extremely important. You can go on to the next slide. So we polled folks from West Louisville, but then we wanted to also poll almost 700 voters in Kentucky and Indiana. You can go on to the next slide. The support for the hospital was overwhelmingly supportive, about 90+% folks thinking bringing a hospital to West Louisville was important and necessary. You can go on to the next slide. But again, what is important in terms of seeing a provider? Does that provider accept my insurance was almost equal to quality of care. And so the folks that we're surveying, and remember, these are folks from Kentucky and Indiana, from all neighborhoods, all counties, what they're saying is that we're equating quality of care to access. And so we're in a different time in healthcare where we understand that access is crucial. Go on to the next slide. I think this is the last slide. And we also ask consumers, what do they want to see Norton do to give back? And they say, help those without insurance. So Heidi, I'll stop there. I try to run through that pretty quickly and see if there's any questions. I hope that resonated well with the folks here on the call today.
Well, first, let me express gratitude that you returned to Louisville. Dr. McCants and I had an opportunity to meet prior to this. I sort of knew it when we invited him to come to the board. And I know the mayor was on for a period of time, and Nicole, and we will take you at your word, especially as it relates to what's necessary in order to increase access. I think the takeaway question, and I'm going to open it to the board, but if the board doesn't ask questions, then I pose this one for you, and tell you that as you go on with your work to continue communicating with us, and that is what policies can this board advocate? We're really good at that. That is the sole mission of the board. The board doesn't operate the department. The board doesn't do things that it did in the past. But what we do is we set strategic priorities for the community as it relates to improving health outcomes and the advocacy for that. So as we move on now, I'll open it for the board, but I will be back to you with regard to what policies have you seen in other areas that have been successful. We were successful in working with council in improving our rental registry and taking away some of the bad things, including adding enforcement that people were the victims of, if you will. So board, I open it to you for questions.
All right, I'll jump in. Mr. Craig Blakely, Dean over at the Public Health School and been on the board for a long time. I just want to make one quick point. We're really fortunate in Louisville, and this is one thing that was very evident to me when I first moved here about 10 years ago, to have the Center for Health Equity doing all the great work that they're doing over in the health department. And it's good to see you use some of our local data, recognizing, of course, that you could use any, as you said, number of cities to make your points. I hope that Nicole, the new administration, continues to really recognize that great resource and plug it and keep it moving forward, because we're actually recognized nationally for some of the work that comes out of the center. And in fact, when I first came here over to academic public health, I was real frustrated to see it over there, not in our school. So we do everything we can to work with them. Dr. McCants, I just want to give you a heads up. I'm going to reach out to you afterwards because we've got some data analytics folks that I want to hook up with you and look for some synergies. But thank you for sharing your thoughts. This is such a critical thing that and to see what Norton's got planned for the near term is exciting.
Thank you. Board, questions? Dr. Eccles?
I just want to say thank you so much, Dr. McCants. This was a really, really enlightening session, one that I appreciate. My tenure on the board has not been as long as some other people, but we talk, every month about health disparities and socioeconomic factors that really impact health. And I think that this presentation really did a really good job of summing up the things that we all know as lay people that really impact health, but maybe that the general public doesn't see. So, thank you for this presentation. Um, and for my question, I think the biggest thing would be you touched on more than one time how important it is, especially for people in Louisville, that they are able to trust their providers. And I think that that's really important. We've seen the impact that that can have, especially in the pandemic, really having not only access to a provider, but a provider you can trust and a provider you can talk to. So my question would be, how do you think that individual providers and maybe even more systemically the healthcare system can kind of really help build that trust with minority communities, marginalized communities, and communities that really are daily facing these disparities that we know are there? Because we can have all the programs and all the access in this city, that money can buy. But if we don't have trust, we're not going to be able to bring the people, that we're trying to reach. So I just would like to know personally what you think some ways are that we can build better relationships with the community.
Great question, and thank you all for your comments. Let me start with that question and answer it in several ways. You know, to build trust, it takes time. And unfortunately, the way that we deliver healthcare, guess what we're limited on? Time. When you're a patient, and I'm just talking very logistically. So when a patient comes in your office, a lot of times we're typing and talking. We're not making eye contact. We're only focused on the one disease that brought the patient in. And it's unfortunate that we do things that way, but that's the way we deliver healthcare. And so we have to change that. And so that's a mindset change. When I see patients, I don't type a single thing. I face them with my body position. And I know I'm going to get the diagnosis right or get pretty close to it. But I talk about some of the other things to help kind of build bridges with those patients. Number one. And so those things as providers require a culture change. And hopefully, as we're training young physicians, we start with that. Number two, building trust. Sometimes you have to have providers that speak the same language, that have the same cultural background, that look like you. And we're at a deficit across the United States, but certainly in the city of Louisville. And so figuring out ways to attract providers and not let them leave the city once they get here is extremely important. And so we're doing some things with some HBCUs to bring in minority providers that look like the community that we serve, not just on an African American front, but also on a Hispanic front. Louisville will have one of the largest Hispanic populations in many Midwestern cities in the next 3 to 5 years. And so we must make sure that we speak the language that our patients are talking about. And from a systemic perspective, uh, you know, we all are involved with key performance indicators or quality. Why not tie in metrics that deal with social determinants of health and trust as a metric? Means let's make sure that patients are able to evaluate providers on trust. It's not me saying it, it's the community needs assessment saying it, it's the health equity report saying it. And I think it's important for us to listen to what the patients are saying. Yes.
Dr. Bautista Severa.
Good morning. Thank you so much, Dr. McCants. Patricia Bautista with La Casita Center, and thank you for your comment regarding the Latino community, because this is the community that I work with. Your presentation was really enlightening, just learning not only about what I knew about the redlining in Louisville, but all the cities and how it replicates. And I appreciate your highlight of the Latino community because it's growing. And as you said, it needs representation with the health providers, not only on how they look, but how the language and the culture. Thank you so much for this presentation.
Thank you. And one more comment about that. And so while we're focusing on the West End, and we certainly have not ignored our Hispanic patients, we have La Clinica, which is our Hispanic clinic that is filled with providers. My community health workers also go rotate through our La Clinica rotation. But we have the fastest growing Cuban population for any city in the Midwest. And so healthcare is going to look different. So we must make sure that we're sensitive to that as well.
I think they're, given the comments that I'm hearing from people, and I would go to you, Dr. McCants, because you're closest to it, and perhaps Dr. Compton as well. I'm just wondering in medical schools how physicians are being trained and whether or not and how not only social determinants of health, but trust, etc., given the learnings of the past and given COVID and the takeaways from that. Is there work being done? And we can, charity starts at home, we can go with U of L, but any comments there?
I'll speak on behalf of U of L School of Medicine. We incorporate that through all 4 years of what we would consider undergraduate medical education, and then we incorporate it into our residency programs as well.
Perfect.
We always try to find ways to increase opportunities to help our medical students, residents, fellows understand all of the points that Dr. McCants just mentioned. I know I myself do similar presentations with our medical students and residents programs, and we have some other folks across the school and other folks like Dr. McCants that continue to spread the message. We do invite folks from the Center for Health Equity. We partner with our colleagues over in the School of Public Health and Information Sciences. So our students are getting that. As for the broader medical school, opportunities there, I can't speak for many other schools, but U of L, I'm proud of the work that we're doing in that
Good.
arena.
Thank
The
you.
key thing is going to be getting those students to stay once they are finished. We have to do a better job there because it's very easy, as has already been noted, for them to get their training here and go be great somewhere else. We need them to come and be great here to help us.
And as you think about what might be, I call it, I guess, it's both economic and behavioral incentives, if you will, to encourage people to stay. I would think that there could be some partnership, and I go to Nicole, with the city and with Mayor Greenberg's commitment and I think there's work that can be done. And if there's anything that the board can do, we certainly stand ready. And point of personal privilege, I'm a U of L alum, so you can do it if you work for a Louisville corporation and on the road during the week, but you still call Louisville your hometown. So anyway, for what it's worth.
Yeah, very. Thanks for both of your comments, and Dwayne, you pointed it out. When I first took this role, I met with some folks over in academia at U of L, and the first thing I pointed out is the retention rate. So you have a decent influx of African American and Hispanic students, but as soon as they finish, they're out of here. And so hopefully with the hospital, with some of the things that we're hoping to do, and not just the West End, but in Louisville, we continue to attract a lot of these patients. I mean, sorry, a lot of these providers.
Do we know what the root cause is to address there?
So Louisville struggles sometimes to be a competitive market, just to be honest with you. And we kind of talked about lack of specialty care. A lot of folks are moving away from primary care, despite us encouraging them to stay in primary care. And they want specialty care. And if we don't have those specialty care opportunities here, it's a challenge. And so we need to create those.
And I think there's an opportunity here with an incoming president and Dr. Schatzel and other positions that we put this issue on the platter as well, and because I think it's critical.
And Heidi,
Questions? Yes.
your first question about policy, that is a big question. And I'm always careful to throw out policies that I read about that I'm not well versed in to say, yeah, let's go after that one. But I think the most important point is for us to leave this meeting, leave this conversation with an agreement to continue to work together and not just say it, but be intentional about how we do that. Because there's things that I don't know from a public health perspective that you guys know. And then there's some things, hopefully, that I can add value for you guys too. So I think rather than embarrass myself and start throwing out policies, Dr. Howard still likes me. I hate to embarrass myself in front of him, but maybe we just kind of agree to regroup and figure out how to be strategic about how we move forward.
Get that done. Questions?
Yeah, this is Bart. I have a question for Dr. McCants. What is your plan, Norton's plan, to work with existing safety net providers, healthcare providers in the West End who have been here for some time?
I don't know if you know, Dr. Irwin is the CEO of Family Health Centers.
Absolutely. Good to see you again, Bart. So we are I hate to keep using the word intentional, but I think it's important. And so when you and I met, I guess it's been 5 or 6 months now. I was happy to meet with you and kind of just say, hey, a lot of people get nervous when a large healthcare provider comes in and says we're building a hospital and this is what we think. We're smart enough to understand that there have been some organizations like yourself, the Federal Qualified Healthcare Centers, who have been doing great work in the community for a long time. It is best for us to collaborate with and partner with, because at the end of the day, one organization cannot get this done. And so I've tried, I know our CEO has tried to meet with as many healthcare providers, including FQHCs, independent practitioners, to just figure out first, what are you guys doing? Getting an inventory assessment. And then figuring out as we start to think about things that we're going to build that we complement and not cannibalize. That is so important to what we're trying to do, that You know, one organization can't do it. It's impossible. And one organization should not do it if it's going to be sustainable. And so we keep those conversations open, but hear it from me, hear it on behalf of our CEO, is that we want to be intentional about collaborating in the West End and through Louisville.
Appreciate that. Thanks.
And just a sidebar here to one of the admin staffs for the city. Could somebody capture all the comments that are in the chat box so that we're clear that we follow up? That would be very helpful to me. I'm ignorant on how to do that. So I've been seeing everything coming in, but don't know how to retrieve. So if somebody can do that, that'd be great. Next question. Okay, well, Dr. McCants, you'll be back. Whether you want or not, we'll strong arm you to do it because this touched on a myriad of issues that are solvable by collaborative partnerships. There's no question about that. And it's really now moving upstream to begin to address the downstream issues that we have. So thank you very much. And may 2023 bring you nothing but the very best.
Well, thank you so much. Thank you guys for your time. Dr. Howard, thank you for the invitation. And please, let's continue to collaborate and figure out how we make Louisville better.
Thank you.
Thank you.
Okay, guys, a couple of issues for your attention. First is there's a new community initiative underway by and between Norton and University of Louisville Health to address the community's continuum of care and related issues surrounding the growing number of unsheltered homeless. So if you'll stay tuned on that, and we'll bring them back for discussion at a future board meeting. Given the board's endorsement of the Parks for All initiative, board members each, you'll receive it to your personal emails, will be receiving an invitation to the launch of this particular initiative on January 25th, and encourage you to attend. Regrettably, I'm out of town for the event, but no, it will be both well attended, successful, and clearly well utilized. It is with great honor now that the chair calls upon Deputy Mayor Nicole George for brief comments on, I guess this is the third day of public service, second day. I don't know how you guys count. And what we do know, just to let you guys know, I think there was something in the chat box for Nicole. The tech isn't working just yet in the city for her, so she needs a little more breathing room, I think. She does have an office, I found out. So, but a better leader couldn't have been directed to public health. And welcome, and we'll allow you to say a few words, and then I want you to come back and talk about your priorities. So we won't ask about that on day 2, 3, 4, or 5. So.
Well, thank you so much for having me, and hopefully my connection is strong for these next few seconds. Just want to say I am really excited to be working with everyone. Want to thank those who participated in the transition team planning. That work is still underway. And so what I hope you see are priorities coming out of Mayor Greenberg's administration and the work that I'm doing that reflect the challenges and the opportunities that were raised as part of the transition team and as part of a conversation that continues. I will put my contact information in the chat so everyone knows how to get in touch. Let me just say that as part of that transition work, those interviews, the correspondence, I have really been energized by all of the exciting work and important work that is happening both within public health and wellness, as well as the value that the board brings to that, particularly as ways that policy and strategic planning is informed in our city. You guys do it, you've been doing it, and I'm honored to be part of it this morning. Thank you.
Thank you very much. And like I said, we will have you back for a deeper dive. The chair calls on Director Dr. Jeff Howard for his update and key priorities for the department for the next 45 days, as well as any barriers to accomplishing those priorities. But I know that Dr. Howard doesn't believe in barriers. He's my co-partner on barrier busting. So there you go. Dr. Howard.
Margos, thanks for the opportunity to address the board again. And I think other people would describe our relationship as co-criminals and not co-partners.
Oh, okay.
Well, first off, let me say, I think Dr. McCants has jumped off, but proud to be his friend and really an unbelievable presentation as evidenced by our board's interest and the questions they were asking were very intriguing. I do want to take a moment of privilege on 2 points to follow up on his conversation. One, the question regarding policy that Ms. Margolis had asked Dr. McCants. It is my opinion that there's so much low-hanging fruit in terms of policy opportunities for our city to improve healthcare with an equity lens that I don't know that we need to labor over which policies. At this point, we just need to pick some and run with them and make sure that we are using a equity lens as we are developing and writing those policies from a city perspective. Second, especially with Ms. George present, and I think our new mayor had jumped off at this point, but I would be remiss if I didn't say that I think the undergirding message of Dr. McCann's presentation as it relates to where we're at today is trust. And we have seen over the last 48 months, maybe more, the degradation of the public's trust in public health at a not necessarily a local level here in Louisville, but certainly a national level, a state level, and I guess to some degree a local level. And it's a national phenomenon due to the politicization of public health during the COVID-19 pandemic. We're all aware of that. And I think one of our key priorities as a public health department, especially as a new administration starts thinking and crafting what their public health policy should look like, a great degree of that, in my opinion, should focus on regaining the public's trust by presence, persistent presence, especially in our communities that have seen inequitable responses over a period of time, including during COVID-19. So we have plenty of opportunities. I'm certainly proud of the work we have done in our underserved communities and our more deserving communities. So I think we got more work to do on that end. And I think those were the key takeaways from me in terms of Dr. McCants' presentation. With that, I'll have 4 quick points and I'll get out of the way for the next talker. But as you saw in your report, the Public Health Department did receive a grant for $150,000 to support our lead poisoning prevention program. As you know, lead poisoning has been one of the top priorities for me as we are moving over the last 6 months and moving forward. I still think it's an area where we have a lot of opportunity. We've had a big policy win, we've had new funding, and now we're continuing to see success in this area. So I'm very proud of the work we're doing on lead, and I believe over the next 6 to 12 months, we will see significant strides in addressing lead poisoning and lead poisoning prevention in our city that will reap benefits, especially in our underserved communities, our West End communities particularly, for decades to come. And so I'm very, very proud of that work and proud of the team for securing that grant. That will go to strengthen our relationship with the Environment Institute. So very, very happy for that. I did want to announce to the board that the health department had received a bronze medal for the City Health Award for policies or for reflecting the success of some of our policies over the last year. So that was a well-deserved award for the team and for this Board of Health, as you supported many of those policies moving forward. Particularly you, Heidi, did a lot of that work. So thank you very much. I did want to give a quick update on infectious diseases. Last we spoke, I had mentioned measles cases, especially the outbreak in Columbus, Ohio. There's been, as we know of today, 80 total cases in Columbus. None here in the Louisville metro area, but we have seen a spread to a area in Kentucky. Bowling Green has seen 1 case that was related to the Ohio outbreak. Again, no cases here. It's something we continue to watch. And we've worked, it's primarily in a specific ethnic community that we've continued to work with closely. And so proud of the team for that work. Monkeypox, I just want to take a moment to say, our team at the health department did a very amazing job. They were stretched thin between the measles outbreak, COVID-19, flu, RSV, and still led a response to monkeypox during that time. We have now exited our incident command structure, but I just want to say hats off to the team. And then flu and COVID-19, as you all know, continue to spread in our community, and something we continue to watch and message. I do want to take a moment to address vacancies. You will find that in your report. We continue to see significant vacancies from the health department. That is up from my last report. Please refer to the report to see those numbers exactly. But I think since we last met, we have offered 50 positions. Nearly 20% were declined, and the most common reason for declining was our compensation not being competitive. I do think that highlights the need for considerations of reforming the structure of the health department, how we fund positions, what those positions look like. And I do think we have some opportunities moving forward. And I look forward to working with Mayor Greenberg and Nicole George on those issues in the coming weeks to months. With that, I'll turn it back over to you, Ms. Margulis, unless there's something in particular you'd like me to address.
That was great. Any questions for Dr. Howard? Okay. And now I'll call on our community advisory board members for any updates that impact the department, or board members, about a minute apiece or 2 minutes. Dr. Irwin, anything from FHC? Or Ashley? We can't hear you. Dr. Irwin, if you're on.
There we
Ashley
go.
Shoemaker. There you go. Okay.
Sorry about that.
That's
I do have a
okay.
good
I can't
announcement.
find you on the screen, so just go for it. There
Okay.
you are. Okay.
Last spring, Family Health Centers partnered with Americana World Community Center to submit a proposal for a Yarmouth Community Project funding appropriation. The proposal sought to renovate the old convent on the community center property to facilitate relocation of our health center there. The health center is currently located in some deteriorating modular units, which have become insufficient for providing care. Emily Dyer, CEO of the Community Center, received a call from Representative Yarmouth a couple weeks ago, who notified Emily that we were successful in obtaining $2 million to renovate the convent. The renovation will expand Family Health Center's ability to provide healthcare services to immigrants and refugees in a much improved facility. So we're really happy about that. That's my
Excellent.
announcement for the day.
Like those kinds of reports. Great way to start a new year. Clean slate with positive items. Thank you. Eva Stone, Dr. Stone, JCPS.
I think she had to drop off. I thought I saw that in the chat.
Okay, is Angela on? We'll have a report back for you guys. One of the things she had, I saw come up in the chat box, the JCPS is adding some medical services with nurses inside the schools, because that will definitely be able to increase access. And so that's what they're working on. Eva and I are meeting later this week. And so stay tuned for more. But in the same way that they served as great vaccination sites for us, this in terms of healthcare becomes critically important as well, especially to those areas with the lowest preventive rates. So, Dr. Val, Medical Society.
Yeah, I don't have anything. We actually have a meeting coming up in a few weeks, but I just want to say Happy New Year to everyone.
Great. Thank you. Thank you. And I think Delanor is out today from the nurses. And Shelby, are you on? July. She comes every other month because she has a conflict. So I'm never clear on which one. That's my problem. Okay. Now the chair calls on committee chairs for any updates that impact the board or need board action. Ms. Shoemaker for Medicaid.
Yes, the Medicaid continuous coverage unwinding is going to begin on April 1st. That means that the state will have 12 months beginning April 1st to do Medicaid redeterminations for all 1.7 million Medicaid members in the state. Right now, the state is estimating that approximately 250,000 people will lose Medicaid coverage. So we need to share with our networks to make sure that Medicaid members update their contact information so that they are aware of when their redetermination is and know what actions they need to take to try to prevent losing coverage.
And I think one of the important pieces, and it's one that I know you'll probably cover on the bi-monthly, bi-monthly meetings of the coverage committee, is what options then they have on the exchange for a subsidized plan. And so I think that's important because we want to assure that as many of those people as possible can qualify for continued coverage. So let's, you and I double back on that just to make sure we do everything we can. And if there's something that the board could do in terms of policy, we'll do that too. Does that sound okay?
Yes, yes. And our next meeting is on February 13th at 4 o'clock.
Very good. We'll do that. All right. And finally, immunization. Dr. Eccles, Dr. Batista Severa. Dr. Bautista, you're on mute.
I'm sorry. At our last meeting, we just would like to recommend for the board to recommend all the health organizations that have vaccination clinics to be straightforward with their message regarding the accessibility. If it's free, to say it's free, or just to make clear if there's any charge involved in vaccines.
That's great. So said differently, people when they go do not realize that they're going to be charged for the immunization, unlike with COVID. So these would be preventive, flu, et cetera, et cetera. So that's what Dr. Bautista Serrera is referring to. So if there are clinics, they need to state if there is a fee for the vaccination or the immunization. Thank you. And that's all. Is there any new business? Any board member have items, announcements? All right, then. The chair will entertain a motion to adjourn till February 1. Meeting will be virtual. Welcome to the team, Nicole, again. Talk later today. You all have a great month. This meeting stands adjourned. Be safe, be well.
Thank you.